massage therapist. In June it'll be 12. So I've been doing this a while. I went to the School of Soma for clinical massage therapy, and me and Mike met over at Delmore. And today I'm going to work on the iliopsoas muscle. So for those of you who don't know that muscle, it's the clean-your-ass muscle. Because when it pinches and it gets tight, it is literally in your glutes. When you've pulled it, you can't stand up straight. So when someone comes in and tells me when I'm walking upstairs, when I'm bending down, I feel like I'm going to fall. My back is going to give out. That's the muscle. That's telltale. That's all right. I'm working there. It's located behind your belly button, down into an angle into your hip joint, and it's two muscles. It's psoas major, psoas minor, and I've got nice fun postcards here, flashcards for everybody. I'm gonna. No, you may not keep. I use these. Well, for people to look at. So these are the muscles that we're going to be working on. I'm going to be working on. Pass those around. I'm going to show you how I find out if that's the muscle that's bothering you, how I'm going to stretch it, and then how I'm going to go into working it. I think I've only worked on 2 points here, and I'm not sure if I've worked this muscle yet. So I'm going to have her sit just slightly off. There we go. We're going to say this is up. Okay. Back your neck. I'm going to bring this leg up. We're going to rock it up. Huh? Probably tight. Can you feel the pinching in your groin? Not too bad? Okay. So now with this leg, I can already tell her ilium is here. I'm going to draw a line. Her knee's out just a little bit. That's telling me that her IT band is tight. So if she's having a pinching feeling, it can definitely be from there, but most of her discomfort is coming from her IT band. If her leg was like this and didn't fall down like that, it would more likely be a quad muscle. But how I'm going to stretch it is I'm going to bring it in line, and I'm going to bring it down. You feel that stretch into, so she's going to probably feel the stretch up the leg, up the quad, and into the groin and move the hip. So that's how I'm going to stretch that muscle. And I'm going to make it even. So this one comes out to the side as well. So it's the IT band. Just stretch. You feel your knee twitching. So when I'm applying pressure down onto the, just above the knee, right on the quad, I can already feel her patella twitching. That tells me her quads are tight. So that we can work on as well. But, okay, so I'm going to help her up. Okay. Now to work on the psoas muscle, I'm going to have her lay onto the table, face you guys. Are going to, can we bring up your shirt? We're going to expose the, no, we're not exposing. We are draping. So the weight I get into the psoas muscle is by, let me see if I can get a bolster here for her. Actually, I'm going to do this too instead and pop it up. So it goes front of the belly button, down into the hip. But in order to properly release the iliopsoas, I have to also work the iliacus muscle, hence iliopsoas. It's 2 muscles working together. As well, the iliopsoas is right in front of the QL, where Mike was working on the side, where you were seeing him kind of working this side muscle. So now, when I go into work this, I generally, very rarely, someone come in and say, I have iliopsoas pain, I need you to work this, and I go straight to that muscle. Muscle's not going to like me, you're going to reject the treatment. So what I have to do is, the protocol that Mike did, I have to have at least 2 or 3 sessions with you before I go straight into the iliopsoas. That's not going to release because that muscle's been that tight for so long that it's been causing pain, I had to get everything around it to release a little bit, just so I can release this muscle. So once I've done those other protocols, 2 or 3 sessions, then I can prepare and actually get in here. You're not that bad. You're tight, but you're not that bad. So I'm kneading the QL, and I'm slowly working into and cupping around the ilium. So I'm getting the iliacus, and then I can strum through the iliopsoas. And just kneading like this will release it. Most of the time, if my athletes, my painters, my laborers, where it does not want to release, then I just kind of rock the hips until I can get it to release, and I kind of cup my hands underneath the ilium, and we just sit there for a couple breaths, and it releases.
Can you physically feel it release?
Yes, it feels like an expanding underneath my fingers, as well as you can feel heat, which is blood flow coming through. You can feel a little bit though. Yes.
You don't get to see the massage from the other side usually.
No, you don't. And a lot of people, when I tell them, all right, that's the muscle, it's in your stomach, they immediately, you're not touching me. It's not that bad. And a lot of times, this muscle can be affecting you more than you realize. And you just, when I'm working it, I rock it. Mike does a similar technique. So this would be the first part of releasing the ilium after I've warmed up the back, warmed up the glutes a couple times. Okay. Now we're going to have her lay on her back. Put this on her legs. Go. Okay. I'm going to, hey Mike.
Yeah.
Can you pull up on the screen for the ilium where they're working the inguinal ligament so they can kind of see how I'm releasing that and then going up into the adductors?
Is that on the psoas protocol?
Yep. It should be the third video from the bottom. So when working that, everything attaches into the greater trochanter, which is the hip bone, the top of the hip. But it's inside that joint. So, if and when he brings it up, so the inguinal ligament is the top of the ilium, and it comes down near your pubic symphysis. Kind of down, but we're not going that far. We're only doing a little friction along the top of the ilium, just to kind of release the inguinal ligament, because underneath that is the psoas muscle. So once we've gotten that released, we're doing some friction around there, which I know does not sound pleasant. Friction it, warm it up, friction it, warm it up. Once that's released, the distal part of the muscle, then I'll work the adductors. Yay! That's what we'll do. And we'll do friction, circular friction of these adductors, because these adductors can get so tight they will pull on the front of the pelvis, on the ilium, and pull it down. So it'll bring your pelvis down, and it can rotate it in, because it's pulling everything. So we want to release these muscles. Nobody likes to release these muscles, but it's very important to foam roll them. Who here foam rolls?
Supposed to.
Supposed to, yeah. We should be foam rolling. My clients don't like it when I tell them they have to foam roll. If you can 3 times a week, 30 minutes. It takes that long. Because if you, yeah, I know, it's painful. The more you do it, the easier it is though. Because you want to work. You don't want to run through them, so you'll do your glutes, your IT veins, your quads, your hands, your adductors, and you can do the back. But when you're doing the legs, you want to take it nice and slow. When you get to that point, you sit on the foam roller with that area and you wait for it to release. And it is normal when foam rolling to have bruising. I know people don't like it when they say immediately a bruise happens. I did something wrong. No, you just released it. That's all it was. That's fine. That's fine. So once these are released, yes.
Should you do foam very slowly or how fast you roll?
Foam rolling?
Yeah.
I go pretty slow. I go pretty slow. You can't, I have my runners, I would love for them to slow down when they're foam rolling, but once you've done it a few times, you can go through the muscle really good, and that's a deep myofascial release. But as Mike was saying, you know how when we, so foam rolling and a lot of massage is that negative pressure. We're pushing into it. But a lot of times once you do that, you also need to come and get massage because we can do the positive pressure of actually picking it up. I'm sorry, is this hurting you? Okay. Picking up the muscle. Picking up the muscle and releasing it because they can all get really glued together. So yes, foam rolling is mashing it down, it's negative pressure, but we're releasing trigger points, we're lengthening it. So you've got to do one and the other. So you also have to pick up that muscle and release it, which we do with cups and kneading and manual therapy. So if you've seen me, you know I use the silicone, I have the glass, and I also have a vacuum cover. So it's a nice big machine that sucks everything up and releases. Any questions? Yes?
Sorry, how about knee pain?
Knee pain?
Yeah.
Where the knee, around the kneecap?
Yeah.
So that can be the quad, that can be the adductors, and the abductors. So that can be the outside, middle, in. So it all depends on the actions that you're doing that is causing the knee pain and what actions that you're doing that don't cause the knee pain. So that's really important to tell your therapist, all right, so it hurts when I do this, but not when I do this. As well as what are you doing to help that, so that it's not causing pain. Are you doing therapy? Are you doing sports? Are you stretching? A lot of people don't stretch. It's very, very important. But if the knee pain is on top of the knee, okay, it can be the yes, this is your rec fat. This is your quad, the top of your quad muscle. That goes from right here. Starts all the way at the ASIS and comes right here. So it goes over this knee joint. It becomes the patella ligament. So if you're getting pain here, you could, not saying you do, you can have a form of tendonitis here, and you can have some inflammation into this muscle because it's tight. So foam rolling can help, but if you have joint pain, you always want to get a release from a doctor or a PT to start doing foam rolling. Okay? You're welcome. Any other questions?
Yeah, so
Yeah.
how'd you get like this other than being couch potato? And then once you've got better, how do you stop it happening again?
How do you stop it from happening again?
Yeah,
You gotta make sure you're exercising.
what kind of exercise?
Oh, a
But
lot
you
of
hear about
exercise.
weight
And you
training, you hear about walking.
well, everything is good in moderation, but you gotta make sure that you're not doing one thing all the time. So you don't wanna do deadlifts, and that's all you do. You wanna do things in moderation. You also wanna stretch before and after. When you work out, you wanna work out with warm muscles. You work out with cold muscles, it's gonna be like playing with a rubber band that's been in the freezer. The muscles are gonna snap, they're gonna hate you. They're gonna hate you for days to come. So it's always important. And who's here worked out without stretching? Oh, come on, everybody, I should see your hands. You hurt afterwards, you hurt the next day. And you're like, oh, that's just me being sore at the gym, working out. No. There is a good soreness, but it's not gonna do you any good unless you're stretching. So it's hard for, once it's happened, it can happen again. So it's important to stay on top of the proper exercise of warming up your exercise. It's being done properly. Most of the time, people who are working out are working out improperly. So it's important to get somebody to spot you, ask a personal trainer, work with somebody who's at the gym, or a buddy. Hey, does this look right? Is my back straight? Are my shoulders elevated? Are my knees bent? It's always important to do those things, as well as cool downs. Make sure you don't go from working out straight to the hot tub. You know, do a cool down, do a stretch, and then ice. I always tell people, if you're going to do a hydrotherapy, ice for 20, heat for 10. You don't ever put heat on your body more than 10 minutes because it's just going to cause stiffness. You're gonna bring the heat there, constantly bringing the heat, the blood flow, but you're not taking it away. So that's what causes stiffness. Does that answer your question?
Fantastic.
Once you get an issue like that, it's really hard to keep it from coming back because your body's now, that's a memory. And that's what massage does, is we remove those memories from jobs, hobbies, injuries. Your muscles retain memory really well. That's why it's so important to stretch, so that you don't keep that memory of the muscle being short, tight, painful. I'm releasing some trigger points you have here in your.
A true therapist.
I don't even know if I can present this one.
She's finding
Any other questions for the SOAS? So now, I hope to see some of you guys in the clinic and be like, all right, I'm ready for you to work into my stomach.
You know, I've known Sarah and what's your name, Mike?
You know, like 2 minutes.
But one of the things they are not promoting massage, and they are really good at what they do. I'm a massage therapist, and I've been to both of them. So, you know, stretching and all of that is important, but you really got to get in and get just what she's doing. She's working because she's feeling things. She could have stopped 10 minutes ago, but she won't because she feels it and she knows that there's something that needs to be done. So if you're not inclined to have massage as part of your program, make sure it's part of your program, because stretching and foam rolling, all of that's
They
great,
are important.
but you really need somebody that can guide you through that. And Mike and Sarah are both great people. I thank you for including me tonight.
Thank you.
You're welcome.
Any questions? All right, now who is excited to learn how to do some stretches? Yeah?
Yes.
All right.
Yes.
Let's get her up.